Let's talk to Tony O'Sullivan, who's co-chair of Keep Our NHS Public. Tony, thanks for joining me this morning. I wonder how big an issue you think the NHS will be in the election. Certainly we see Wes Streeting, the shadow health secretary. Let me just briefly read you what he has said to the Sunday Times, if I have a copy of it. I do, in my pile of papers. He says, "No one can honestly say the NHS is offering the best care today. The millions of patients forced to go private are testament to that, as are the frontline staff trying their best, but sustaining severe moral injury because they can see their best isn't enough. They're crying out for change." What do you think, Tony?
Oh, hi, good morning. Thanks for having me on. I think that we should regard the state of the NHS as a national emergency, to be honest. It's been very badly undermined to the point where there's over 250 people dying avoidably because of delays in the A&E pathway every single week. And that's something that we're not talking enough about. And the over 7.5 million people waiting for different procedures and assessments has led to a stunning fact. I don't know if you've heard this, that in 1 year alone, 2022, 39,000 people awaiting cardiac investigations died prematurely.
The problems are really clear, Tony. You've illustrated them well there, and we do talk about them quite a lot on this station. I'm not asking you, obviously, to endorse a political party. I wouldn't do that. And I'm sure, well, you can if you want to, but I expect you're not going to. Are there political parties that you think have good ideas in terms of sorting out the NHS? Because I just remember a very senior person in the NHS I was speaking to recently who told me that there's always going to be a crisis in the NHS. It is such a large organisation. It employs so many people, and it's never all going to be perfect.
I think some of us need to rejig our memories and go back to the time when the NHS was properly funded, and the fact that it was regarded as the most cost-effective and safe and accessible service in the world in 2010, and in recurring assessments by the Commonwealth Fund.
Well, the funding, though, if we just look at the bare facts, and you know this better than I do, I think, now this is off the top of my head, but I'm pretty sure that in 2010, the NHS in England anyway got £139 billion. Now it gets £180 billion. There are loads of public services that would love that kind of increase over the past 14 years. So this isn't just about money.
Right. Well, first of all, when we talk about figures of hundreds of billions of pounds, I imagine viewers just can't comprehend what that is. So in a way, we have to compare it like with like. And the NHS is underfunded considerably compared to, for example, France and Germany. But so that's a really important sort of context.
And also the context of that, and also, Tony, just sorry, quick point, and then I promise I'll let you talk, but also the context of that is that in France and Germany, they do things differently. They don't have universal healthcare free at the point of need.
Well, I feel we should go back to basics. That the NHS was actually functioning the best in the world when it was funded according to the needs of the service and the needs of the population, and not underfunded for party political reasons. The country itself cannot function without a strong and safe NHS. And I think that political policy is actually undermining the economy over the last 14 years. Do you know that there's nearly 3 million people who are unable to work for health reasons? And they are one of the casualties.
So are you saying, I don't want to put words in your mouth, Tony, but are you saying that Labour have the ideas to fix this? If you're saying everything was fine in well, not everything, but a lot of things were better in 2010 after 13 years of Labour government, you're saying after 14 years of Conservative or Conservative-led government, they're not good. Maybe perhaps, I'm not asking you to endorse a political party, but perhaps you're at least encouraged by what Wes Streeting says.
Well, I'm not going to endorse a particular party, you're right. I'm worried by the Labour Party's arguments that we need a strong economy in order to afford a strong NHS.
Isn't that correct?
I think it's exactly the other way around, Peter. I think that, and if you look at assessments, for example, by the International Monetary Fund, not a left-wing think tank, they argue that investment in health gives a payback to the economy of something like 3 to 4 fold, but also that you cannot have a strong economy unless you have a healthy
Okay.
workforce. And at the moment, we've got an unhealthy workforce, 3 million people out of work because of waiting for healthcare. And we have an increasingly stressed NHS staff who are demoralized and looking for work elsewhere.
Okay. Okay.
They're trying to fill 120,000 vacancies. They're being almost forced to do extra shifts. The most cost-effective route has been shown to be a nationally run and publicly provided service.
Okay.
That, in that sense, relevant to what you were saying about France, for example, the well-run, well-funded NHS is actually more cost-effective than a social insurance model.
Okay. Okay.
But I recognise that France has a very good health system,
Yeah.
Germany has a good health system, but they're funded hugely more.
And in a very different way. Tony, thank you. Tony O'Sullivan there, co-chair of Keep Our NHS Public.